Tendons are going to be from muscle to bone. Ligaments are going to be from bone to bone. I encourage people to get wide toe box shoes. People who have bunions or more prone to being narrow shoes, that would help.
Hey everybody, Michael here with Kalkstein Chiropractic, along with
Dr. Jonathan.
We are doing another infamous Q&A with one of the docs, just an eclectic mix of FAQs. Starting with posture braces. What are your thoughts? Do they work?
They can be helpful. They're not one of those type of braces where they're gonna like fix your back or fix whatever you're bracing, but if someone's coming in with really hot low back pain and they have to like sit or stand a while and they can't actually support their own spine, that's when we will recommend a brace for that, so they can get kind of past that window of just being a little bit more functional and stable, what the core muscles should be doing, but when they're really that acute in pain, that's my opinion as far as when they would be useful.
Gotcha. And I guess we also have some other braces that we can sort of offer in terms of like low back and ankle, all the extremities.
Yep, exactly. So depending on the injury, then taping or even bracing would be appropriate.
Got it. So they're not just gonna fix your posture magically, right?
Yeah, they wouldn't really fix your posture. They might like encourage what your body should feel like when you're in an upright position, but yeah, not anything that will be wear and then one and done type of thing to posture, but gotta earn that.
If only it was that easy.
If only.
Okay. So footwear, especially with people who have low back pain, what should they be looking for, thinking about, opting for?
Yeah, so I think a lot of times, especially now, shoe companies are really promoting extra support, and they have really thick outsoles, and people with low back pain can benefit from these, but mainly we'll start with shoe wear in general. So a lot of shoes are very narrow in their sole, and if you can look for what we call wide toe box shoes, where the measurement is from your big toe to your pinky rather than like the bottom of your big toe to the outside. The reason is for that when we walk naturally, our toes should splay, and then if we wear too narrow shoes, they can't function and spread that way. So I encourage people to get wide toe box shoes. People who have bunions or more prone to being narrow shoes, that would help. As far as like helping low back pain with better shoes like that I'm mentioning, it could help down the road once that patient or person is able to really utilize the shoes in a way that the feet and toes are functioning well on its own, and that whole kinetic chain up to the low back can benefit from that, because low back down to your feet, if one of the things, hip, knees, ankles, are dysfunctional, that can definitely play a role in how our back feels and functions. So yep, I would agree. Some shoe wears are better than none, or some. High heels, dancing shoes, those are kind of for show, not functionality, but I get it. You know, I'm a sneakerhead myself. So if you can offset your things with movement and encouraging your feet to display how they should, footwear can be a luxury in the sense that you might not need a wide toe box shoe yet.
Yeah, makes sense. And I've seen some more stylish, wider toe box shoes these days. They're not as goofy as the Vibram. Sorry, Vibram, I need to call you out there.
Yeah, they were the originals though.
They were.
Those toe shoes.
Yeah.
Yeah, I had a pair of those.
The toe gloves, whatever they call.
Yeah.
But no, they've stepped their game up, I think, in that category.
For sure.
All right. So last question we've got. This is kind of a out of left field one, relatively speaking. Tendons versus ligaments. Can you briefly explain the difference?
Yeah, great question. I think a lot of times people get confused with one or the other, but a simple way I remember, tendons are going to be from muscle to bone. Ligaments are going to be from bone to bone. So a tendon, I think of it as the T is very tensile, like muscles can be when you contract it. So that's how I remember there's muscle with that. Tendons are usually gonna be responsive with progressive load. So if you have a tendinopathy, tendonitis, a lot of times just tissues at those junctional areas, let's say tennis elbow, can get really inflamed just because a lot of people do computer work, and tendons can respond well to progressive load to release that tension. Ligaments are going to be more supportive, like I said, with bone to bone, very small intricate ligaments in each joint, even in our back. And when we assess movements with any joint, we'll ask the patient to actively move, passively move, which the doctor or someone will move their joint into different ranges of motion. And then that's where we can determine if we're dealing with a ligamentous injury or a tendon injury, where ligaments will respond where not muscles are engaged, so you can move a little bit more past what we call the physiological barrier. And I kind of went off tangent of what tendons and ligaments are, but essentially bone to bone, ligaments, tendons, muscle to bone.
And contrary to popular belief in vernacular,
oh, here it comes.
the patellar tendon is actually the patellar ligament we've been talking about in the office. So, yeah, we gotta change how we speak.
Yeah, it's bone to bone. But
bone to bone.
Any more questions, please write them down below. Like and subscribe, and we will see you guys next time.